Thank you, Devon, and welcome to everybody. Thank you for joining us. And as Devon mentioned, I'm going to be doing an introduction to knowledge translation. Our learning objectives for today are for you to get an understanding of the role of knowledge translation in patient-oriented research. I'm hoping you'll be able to differentiate between end-of-grant KT and integrated KT. And you will hopefully recognize the core elements of a good KT plan. But we will start with a question. KT in patient-oriented research, why bother? I always like to start with the why question. Why is KT important? Why is knowledge translation important? KT is a method to move research into action. And as researchers in patient-oriented research, we want to know that our hard work will have a positive outcome on patients' lives. But just because your results or your synthesis show positive results, that doesn't mean they will automatically be used. We have to plan to help move this knowledge into action. Knowledge translation is an integral part of the research process. It's not an add-on at the end. I don't want you to think about KT just because the grant proposal you are writing requires it. I want you to think of the broader implications of your research. Who will benefit from this knowledge, and how will you inform them? You may have seen this graph before, and it highlights a couple of valleys that are affectionately known as the valleys of death. And Ian Graham summed this up nicely back in 2006. He said, despite the considerable resources dedicated to health sciences research, a consistent finding from the literature is that the transfer of research findings into practice is often a slow and haphazard process. In fact, it's been said that it takes 17 years to translate evidence from discovery into healthcare practice. But only 14% of it is believed to enter day-to-day clinical practice. Knowledge translation is a means of addressing this challenge. It's about moving your research more effectively along this research to practice continuum. So what exactly is knowledge translation? The Canadian Institute for Health Research, or CIHR, defines it as a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of Canadians, provide more effective health services and products, and strengthen the healthcare system. Now, if you haven't really heard this before, it's a pretty long definition, and it doesn't always resonate with people. And so we've created a shorter version to make it a little bit easier to understand. And it's really a method for closing the gaps from knowledge to practice. Or it's a bridge between what we know and what we do. It's a bridge to help cross those valleys more effectively. So again, why knowledge translation in poor? Well, as the WHO Director General had said, action without knowledge is wasted effort, just as knowledge without action is a wasted resource. And it's important to recognize that there are many different types of relationships between the knowledge producers and the knowledge users. There's a linear model, which is based on the assumption that knowledge is produced and packaged independently of knowledge users and handed over. But we also know that this isn't the most effective way for knowledge uptake. The feedback model allows knowledge users to provide feedback on the knowledge findings and potentially influence subsequent research. A collaborative model puts knowledge producers and knowledge users side by side and enables them to talk to each other throughout the research process. Co-production, or joint production of knowledge, dissolves the boundaries between knowledge producers and knowledge users and draws on multiple ways of knowing to contribute to the knowledge production. So let's revisit the CIHR definition of knowledge translation and break out some of the key pieces. So you can see in this definition that there's 4 pieces that are highlighted: synthesis, dissemination, exchange, and ethically sound application of knowledge. And 2 of these, the synthesis and application pieces, fit specifically within the knowledge to action framework. And hopefully some of you have seen this knowledge to action cycle before, and it has 2 main components. The middle section encompasses different aspects of knowledge creation. And here you can see the first part of our definition highlighted, knowledge synthesis. And outside is the action cycle. And this refers to the application of knowledge, which was mentioned in the fourth part of that definition. That leaves dissemination and exchange, which we're going to talk about in more detail. CIHR divides knowledge translation into two broad categories, end-of-grant KT, which is more along the lines of the dissemination piece of the definition, and integrated knowledge translation, which can be more likened to the exchange piece of that definition. But in both cases, the goal is to ensure that new knowledge generates action. For end-of-grant knowledge translation, researchers should be engaging with relevant knowledge users to craft and tailor messages and help disseminate research findings. So this is done, your engagement with your knowledge users is at the end of your project, whereas for integrated knowledge translation, potential knowledge users are engaged throughout the research process. So we're going to talk about these two separately. So end-of-grant KT, as I said, refers to the dissemination of findings generated from research once a project is completed. And it's not quite as simplistic as this cartoon suggests. Many grant applications require researchers to think about their strategies up front and not just as a last-minute add-on at the end. The researcher needs to develop and implement a plan for making potential knowledge user audiences aware of the knowledge gained from their research project. The following 5 components should be addressed in any end-of-grant KT plan. These factors are the same regardless of the domain of research, though how they apply will vary. So your KT goals need to be very clearly defined and justified. You need to identify and justify the target audience. The nature of the target audience and the type of evidence will determine which strategies you use. The specific KT goals, audiences, and strategies planned for determine the appropriate level of expertise needed for end-of-grant KT. And end-of-grant KT can only be successful if the appropriate resources are dedicated to accomplish the proposed activities. So there are 2 broad goals typical of end-of-grant KT activities, raising awareness and promoting action. And whether your goals are modest or ambitious, they must be appropriate to the nature of the research findings and the target audience. So you don't want to get too ambitious. So for instance, if you discovered a new calcium channel, you probably don't need to promote action and tell clinicians. But you probably want other researchers to know how this research impacts future research, and so therefore you're just raising awareness. However, if your new calcium channel affected how a certain drug worked in a given population, you may want clinicians to know and change how they prescribe the drug, thereby promoting action. You need to make sure that your KT goals are very clear, concrete, and well justified. And the KT goals need to be appropriate, of course, to the potential research findings and to your target knowledge user audiences. So who needs to know about your research? There could be, and often is, more than one audience, and it is acceptable to prioritize, but you need to provide rationale for selecting one over another. Does your plan consider all potentially relevant knowledge user audiences? Are they precisely defined? Simply mentioning clinicians, managers, policymakers, etc. is not sufficiently specific to make clear that the audiences selected are appropriate to your goals. And your plan needs to demonstrate an understanding of the proposed target audiences. You need to try to understand the current state of their knowledge, how they tend to use knowledge, and the formats in which they prefer to receive their information. Do they like full reports? Do they like summaries? Do they like key messages? For example, in my experience, physicians really like those key messages. They like to know that there's evidence backing up those key messages, but when it comes right down to it, they're busy people and they just want to know the take-home message. The concept of end-of-grant knowledge translation incorporates a continuum of activities or strategies that can vary in their level of intensity from passive to active. And of course, the level of effort will increase as we move along this continuum. So diffusion is otherwise known as letting it happen, and this is our typical publishing in academic journals and presenting at conferences. The next step, called here dissemination, is helping it happen, and this is where you might create summaries or educational sessions or those key messages as I mentioned. Application or implementation is helping to make it happen, and this would mean identifying some barriers. You're going to have to tailor your messages a bit more, as well as the interventions. The application aspect is a fundamental component of integrated KT and is seen less with end-of-grant KT, but it doesn't mean you shouldn't think about it. When selecting strategies, researchers should propose methods to reach their identified audiences and deliver on the KT goals that are appropriate to the research results, which means you should consider, are the key messages clearly identified? Are the strategies appropriate to achieve the KT goals? Is it awareness or action? Does the plan take into consideration the context in which the knowledge is to be used? Is it going to be used in a rural setting versus an urban setting? Is it going to be in a policy environment or a clinical environment? If appropriate, is there a plan to adapt the knowledge to each specific audience? Have mitigating factors been considered that might affect the applicability of the research findings or the effectiveness of the planned KT activities? For instance, if you're promoting action, have knowledge users or relevant knowledge user research been consulted? And does the plan consider barriers and facilitators for knowledge use? So for example, if you're trying to inform patients, have you used summaries or tools with appropriate language? The expertise represented should be driven by the KT goals, audiences, and strategies. Are all necessary knowledge users involved to achieve your stated goals? Is everyone around the table that should be? Is there a sufficient description of the team's ability to execute the proposed strategies? For instance, if you're targeting patients, do you have someone on the team that can actually write plain language summaries? You may also want to consider having a patient at this table, or there may be other members of your target audience you might like to collaborate with or include at this stage. You should demonstrate that the proposed KT activities can be delivered. Does the budget allocate adequate financial support to implement the plan? You need to consider financial resources, human resources, and also access to resources. So we'll switch gears now and talk about integrated KT. And this involves engaging and integrating those who will need to act on the findings, your knowledge users, into the research process. And this helps to produce findings that are likely to be directly relevant to users' needs. Another term that has been used is engaged scholarship, and this is defined as a form of collaborative inquiry between academics and practitioners that leverages their different perspectives to generate useful knowledge. And it's based on the belief that higher quality, more relevant research results from true collaboration and from integrating the diverse perspectives of multiple stakeholders. So who are knowledge users? And this can really be anyone, practitioners, patients, patient organizations, caregivers, whole communities, decision makers, policymakers, institutions, professional colleges or associations, research funders, industry. And when you're thinking about your potential knowledge users, try to stretch your thinking and think a little bit more downstream about potential knowledge users. One of the main advantages of integrated KT is the involvement of your knowledge users in all stages of your research. Not all knowledge is published in peer-reviewed journals, and there's increasing recognition that there are many different sources of evidence other than research that must legitimately inform decisions. Your knowledge users also have a unique understanding of the results, which may be different than that of the researchers. And they are also well positioned to move these results into practice, which many researchers don't have the time or capacity to do fully on their own. And this is one reason why research can stall in those valleys of death. Integrated knowledge translation involves significant collaboration with knowledge users, meaning joint decisions for development or refinement of the research questions, selection of the methodology, qualitative or quantitative or a combination of the two, data collection and tool development, selection of outcome measures, interpretation of findings, as well as crafting of the message and dissemination of the results. According to the Canadian Institute for Health Research, the CIHR, the minimum requirement for integrated KT is that researchers and knowledge users make joint decisions to shape the research questions, interpret the study findings, craft messaging around the results, and move the research results into practice. But I find that outcome measures are another important and relatively easy place to get knowledge user input, because this helps identify outcomes of relevance to knowledge users. For example, there's a study that's looking at changing when patients take their blood pressure medication from the morning to the evening. And the primary outcome that the researchers identified is a composite of all-cause death and hospital admission or emergency department visits for acute coronary syndrome, myocardial infarct, heart failure, or stroke. And while I'm pretty sure the patients are interested in these types of outcomes, when the research team actually engaged the patients, they found that an additional thing patients were interested in was how many times would they have to get up in the middle of the night to go to the bathroom. And this was a really simple outcome measurement for them to include in their study and to be able to collect and to be able to report back to patients. So in developing an IKT approach, the CIHR asks you to consider these 4 factors, which we'll go through in a little more detail. So an important objective specific to an integrated KT project is responding to a problem or knowledge gap identified by your knowledge users. So that your research question should be developed with your knowledge users. It needs to be clearly articulated and be clear about the origin of the research question. Why is it interesting? Who is interested in it? How do your knowledge partners view it? And what potential benefit does it bring to the knowledge users? And that doesn't mean that you have to create the entire research program consulting with patients or your knowledge users first, because they may not necessarily know the state of the evidence. So it's perfectly fine for you to come forward and suggest that this is an area that you think would be good to investigate, and then start to get their feedback from that point. You don't have to start with a blank slate. As with all research, the approach or methodology will be driven by the research question. You don't start out saying you're going to do a certain methodology or a randomized controlled trial. It really should be driven by the question. An integrated KT methodology can evolve as the project proceeds, and it may not be entirely determined at the outset. Therefore, it's important to engage your knowledge users throughout the research process. For instance, you may have started out just with some quantitative measures, but as you've been working through and collecting some data, you may have identified that it would be helpful to have some qualitative data to address some values and preferences that weren't initially identified by your knowledge users. So be very clear and specific about your proposed methods, and demonstrate the participation of and commitment to the project by your knowledge users. Feasibility requires a clear demonstration that the researcher knowledge user team has the requisite skills, experience, and resources to complete the project in the proposed time frame. Potential risks need to be addressed. Knowledge users can change jobs, and especially in healthcare. Evidence of an ongoing commitment from the organization or the knowledge users is ideal, and it's helpful to have a collaborative agreement to address any conflicts. The knowledge users need to understand their roles, especially in the area of integrating the new knowledge into the environment where they practice, and you also have to demonstrate that you have the right knowledge users as participants or as partners. An integrated KT proposal should clearly illustrate how it will potentially have a demonstrable and sustainable impact on practice, programs, and/or policy that could ultimately lead to a change in health outcomes. Consider the potential impact of the study and its transferability. If it is not transferable, acknowledge and justify this. It should be noted that integrated KT programs also require a dissemination plan, so you need to include a detailed plan for your end-of-grant KT. And you also need to develop a reasonable evaluation plan to be able to measure the outcomes and impacts of the study, as well as to assess the process of the IKT approach and to learn about barriers and facilitators for collaboration. A KT plan is like a roadmap you will follow as you drive knowledge or research into action. It provides the knowledge translation vision as well as the details of how to achieve this vision. There are many different KT planning tools available, and I've highlighted a couple from the CIHR, but they can very often be context sensitive. So a tool designed to get evidence into clinical practice in acute care sites may not be the tool to use for trying to achieve a different end, such as public policy change. Our team reviewed a lot of the different toolkits and identified some of the core elements that are common to all and provide a starting point for thinking about your own KT planning. And it basically goes through the who, what, when, why, and how to do KT. And underlying that throughout is considering project management and evaluation. As I said, it's always good to start with the why. So you need to identify what is the problem you are trying to solve and how will knowledge translation address this. So it could be, as we said, as simple as generating awareness of an issue. You might want to share tools and information. You might be providing knowledge and skills to a very specific key audience. You might be generating or supporting a policy change. You could be generating a clinical practice change, and there's other potential goals. Be very specific about what you're hoping to achieve and make sure that it's doable with the research you're undertaking. For who, as we mentioned, you want to identify your target audiences, but it's also very important to identify the credible messengers. So your audiences could be practitioners, patients, professional practice organizations, healthcare sectors, policymakers, decision makers, thought leaders. It could be the general public or any number of others. And once you've identified who your audiences are and you've understood what your messages are, you want to think about who the credible messengers might be, because it may not be the researcher. And if you're doing an integrated KT plan and you have some of these knowledge users on your team, if you have a clinician or you have patients or policymakers, this is where it's very helpful, because then they become your credible messengers, because it's much easier for physicians to talk to physicians and policymakers speak the policy language, etc. So think about who is going to be delivering that message for you. And then, of course, what exactly is it that you want to share? You need to develop key messages that are specific to your KT goals and objectives. They need to be very clear, simple, action-oriented statements. Identify what the research means, why it matters, and what action should be taken as a result. And it will most likely need to be tailored to the needs of each specific target audience. What do you want to tell people? What do they need to know in order to create change? And then there's the how, and we mentioned the different potential strategies. It could be, again, just the level of awareness where you might be presenting at an event, but it could be more interactive. It could be more of a workshop or a lunch and learn, more interactive. And there's trade-offs between exposure and interaction with recipients, and it'll come down to the amount of time that you might have to be able to do this. You might get greater reach with certain strategies, but less direct interaction. And you need to assess whether two-way communication is going to be important to meet your KT goals, instead of it just being a push form of getting the information out there. And it's important to tailor the products and the activities to your target audience needs, as we mentioned. When, of course, you want to align the timing of your activities with your KT goals, and it might be sufficient for you to just focus on end-of-grant KT activities. Depending on the research results, this is perfectly fine. But it could also be integrated KT. If you're expecting people to change, then it's very helpful to involve them as early on in the process as possible, because once they understand the whole process and the reasons for change, they're more likely to change. And there are lots of other considerations, especially around project management, identifying who is going to help you with these knowledge translation activities, developing work plans and timelines, really identifying roles and responsibilities, and laying out so that the researchers understand what the knowledge users are able to do, and also for the knowledge users to really understand what their roles are and to understand the research process a little bit better. Because everybody works on a slightly different time. The researchers need to let the knowledge users know that they're constrained by the funding deadlines and the grant deadlines, and the researchers need to understand that these knowledge users that they're involving probably have other full-time jobs and are not available at the drop of a hat. We mentioned budgets and resources. It's important to make sure this is highlighted and outlined. If there's any event planning, make sure you consider that. And there's a number of other potential factors. As well as evaluation, and we mentioned this, identify the areas of intended impact, focus on the outcomes and the results rather than just the efforts. Identify some indicators, and this could be indicators that establish the reach of your results, the use or usefulness, any partnerships that are developed or any changes that were made, or any indicators that can measure the changes. And there could be other factors that you want to consider in terms of evaluation. So we've put this together in a generic planning tool that, again, sort of takes you through the steps. And as I mentioned, there's no specific tool that you need to use, but there are a lot of core elements that you should be considering. And so this sort of takes you through all of that when you're developing your plan. So I got through that a lot quicker than I was originally expecting, so we can open it up for comments or questions.
Thank you very much, Gabrielle. That was very interesting. As I can see in the chat box, Chris is typing. So as we wait for his question to be entered, we do have a question here in the room. So as you mentioned, there are some kind of barriers limiting researchers, but I guess one of the questions we had is, what is the greatest barrier preventing researchers from applying KT practices? And then I guess second to that, how do they overcome those barriers?
Well, I think the biggest barrier of researchers applying these KT practices is not engaging with your knowledge users and really understanding what information do people need from you. It's one thing to do curiosity-based research and publish really interesting results, or even if you're doing a randomized controlled trial and you've got your set of core outcomes, but if you haven't really thought or talked to the end users and understand what it is that they need to be able to do their jobs or to make a change in their health behaviors, I think that's the biggest barrier, is identifying who these people are and how you're going to go about working with them.
Thank you very much. That's very helpful. I know that's a question lots of different researchers have. So I guess returning to the chat box, it seems we have a few questions posted. Chris has asked, what are some of the biggest misconceptions that you find people have about KT?
That's a good question. And from some of the researchers that I've been working with, I think a lot of researchers are still stuck in thinking about KT as being just that diffusion piece that we need to publish and we need to present. They're starting to understand that they need to engage additional people, but I don't think they realize just what it takes and how much you need to put into developing these plans. And as I said at the beginning, it's not just an add-on, and it's not just for your grant proposals. And I think that's how people have been approaching it. More and more, there's more grants requiring a knowledge translation plan, and a lot of people don't really understand what that means. And I'm hoping that this type of a presentation outlines just what it is that the funders and people are looking for when they're looking for a knowledge translation plan. It's more than just that publication and publishing your results. Like, the results alone are not sufficient to change behavior. The evidence alone is not enough. And I think that's where people need to start changing their mindset.
Thank you. So we have a few more questions, and it seems a few more people are typing. S. Dead says they really appreciate the KT for patient research. The question asked, though, isn't generating knowledge for the sake of knowledge enough motivation for research?
Well, I agree that we should still have that curiosity-based research and knowledge for the sake of knowledge. But if nobody's actually going to use that knowledge, is it then knowledge? Like, if it's not being shared and utilized, and it's just sitting on a shelf somewhere, it might be a great piece of information, but it's not valuable until it's actually used. And so even for curiosity-based research, I think that there's still a place for people to think about developing an end-of-grant KT plan and thinking about who could potentially use this research, what are some potential downstream effects, and really thinking about making the best use of the dollars that we have to do research and make it accessible to everyone. And one example, I was talking to some researchers that were developing a diagnostic test, and they were working with the clinicians, and so they were doing a lot of really good work in the clinic, but I stretched them to think about talking to policymakers, because if it turns out that this test works and it does what they want it to do, they have a better likelihood of getting it funded, perhaps, if they've talked to the policymakers and understood what knowledge requirements they have to be able to make their decisions for funding. So if you thought about that earlier, it just makes it that much easier for that research to be incorporated and used. I hope that answers that question.
Yeah, I think that can be a hard question to answer in general, but I think it definitely is helpful. Raya, sorry if I'm pronouncing your name wrong, asked, are there resources within institutions and across Alberta to support KT? So I'll leave that up to you to answer, Gabrielle.
Absolutely, and that's what the Alberta Spore Support Unit KT platform is here for. That's what we do. Any researcher, and that includes clinician researchers and students across Alberta, are able to apply through the Alberta Spore Support Unit for support in doing your research. If you have questions and want support with your KT, that's what our platform is there for. And there's a number of other platforms within the Spore Support Unit that can help you with your research. And so yes, and there are, I think, resources within Alberta Health Services as well. So there are a number of different places where you can access support. So I would encourage you to reach out to us if you're looking for KT support.
Michelle asks, people have often asked her if there's a difference between IKT and patient-oriented research. She asks, what do you think?
Yes, there is a difference between integrated KT and patient-oriented research. So To do patient-oriented research well, it will be an integrated KT project, but not all integrated KT projects will necessarily be it will include patients or necessarily be patient-oriented. It's still possible to do integrated KT without it necessarily being patient-oriented. But as I said, most patient-oriented research, if you want to involve the patients and have it really directly related to them, it should be an integrated KT project.
Goodness, we have a lot of questions coming your way. Jenny asks, do you have an example of a completely out-of-the-box strategy for knowledge translation that has been really successful?
I'm not sure that I have anything completely outside the box, but there's a lot of social media strategies that are being utilized that seem to have quite good reach, and there's a lot of new novel potential strategies that can be used utilizing different formats of social media. But again, it's understanding who your knowledge users are, who are your target audiences, and how do they like to get their information and their knowledge. And so if you can target those, I think that you'll have much more success. So I can't think of any others at this point.
Thank you for that. Alex writes, you mentioned that researchers should assess the reach of their studies to the knowledge users. Could you elaborate on this and give an example of how this would be done?
Well, I think the example that I had provided earlier with the researchers that were developing a diagnostic test, and as I said, they were working with clinicians in the unit to make sure that they were meeting the needs of the clinicians. But I had suggested that they think a little bit farther down the stream and consider that if this diagnostic test was successful and they wanted Alberta Health to publicly fund it and make it accessible, that they should reach out to policymakers and identify what type of information they would need to make their decision to fund it, and then perhaps start collecting that data earlier in the process and have it ready for when that situation might arise.
All right, thank you. Jocelyn asks, are there particular types of research or certain research questions more appropriate for end-of-grant KT versus integrated KT, or vice versa?
Absolutely. I think that there's a lot of research that, especially that a lot of the Pillar 1 upstream curiosity-based research, I think is better to just consider end of grant, and pilot projects and that sort of thing. You might not want to do a full-scale integrated plan for, but there's always advantages to involving any knowledge users in the research process. But there are definitely some research questions where you wouldn't necessarily want to do a full-blown integrated KT plan. It may not be feasible. You really do need to assess whether or not it's feasible. And so there is times when it's perfectly fine to do end-of-grant KT instead of IKT.
And, oh goodness. Simon has asked if you could possibly repeat your discussion about dissemination and implementation, particularly regarding strategies, and provide some examples or elaborate on this topic.
I'm not sure I understand the question.
I think he's just wanting to know if you can just repeat some of the strategies for dissemination and implementation, and maybe provide some examples. I know you've provided a few already, so maybe just some of the strategies that are most effective for dissemination and implementation. I hope that is what he's asking. If not, please type in the chat box and correct me. Well,
in terms of strategies, again, it's really identifying what your knowledge users need to know and how they like to get their information. So as I said, clinicians and physicians like key summaries, like the key messages. They don't always want to have to read the full research report. They like to know that it's there, the evidence, but they're too busy to read a lot of information, so they want the key messages. And in terms of implementation strategies, if you really want to get something utilized, you need to identify what might be the barriers to that practice change or policy change. To implement that, what are the barriers, and then specifically targeting your strategies to address what those barriers are. So in terms of dissemination, you might not have as in-depth of a strategy. It might just be a summary or an infographic, something like that, to make it to synthesize and distill the information into a few key messages. Implementation requires more effort and more targeted strategies, and that will depend on, as I say, what the barriers might be.
Thank you again. All right, so Clayton is asking, in integrated KT, to what extent should the knowledge users involved match the target users?
There is actually, they should all pretty well be the same. The people that you're involving as partners in your knowledge translation plan could be different than the people that, a lot of different people could potentially use the knowledge, but not everybody needs to be involved in the research process and in generating that knowledge, because it'll depend on who could actually facilitate that change. And so, for instance, the research that you're doing might be very relevant to patients, but you may not need to involve them in your IKT plan. Instead, you might need to involve managers from a hospital unit, because it's those managers that are going to be making the decisions that will affect whether or not this research is available to the patient. So they may not need to be as involved. So there is some overlap between your target audiences and your knowledge users, but who you choose to be partners could be slightly different than the expanded list of potential people that would benefit from hearing about your research.
Thank you, Gabrielle. It seems some people are having some issues with sound. I do apologize about that. I know that there have been some internet connectivity concerns throughout the campus. If you are somewhere on the University of Alberta campus. But I do hope if anyone is having trouble hearing, you can listen to the recording of this presentation later on and hopefully catch some of what Gabrielle is saying. Just to move on to our next question, Chantel is asking a very similar question to Clayton, but she is more so asking in regards to the KT plan itself. So when identifying the target audience for the KT plan, do these individuals need to be named as knowledge users? So I don't know if you'd like to, if you feel you've answered that, or if you'd like to comment on that, Gabrielle.
It's probably a similar answer to what I had said, that you want to identify who your target audiences are when you're developing your KT plan, but those might just be the people that could benefit from hearing about this research or knowing about the research, as opposed to the knowledge users that are your partners in carrying out the research. And so those particular there is overlap between target audience and knowledge users. But as I said, the partners would be more intimately involved, and you could have a broader list of potential target audiences that you might want to generate awareness with.
Thank you for that. So it seems the last question we have, unless, people are typing. If they have more questions, let us know. But the last question so far, Jenny asks, do you have any good plain language resources to aid in getting the research to be understood by non-academics / non-clinicians? I
can't think of any specific resources off the top of my head, but I know that there is a lot of information out there. And again, this is something that if you come to us, the KT platform can help you with. We're going to look at developing some of these tools or to create some templates to sort of highlight what kinds of information that you need. But there are a number of different workshops and courses too that cover off plain language. But for sure, you can get in touch with us and we can help you identify what that is.
Wonderful. Thank you so much, Gabrielle. So it does not seem that there are further questions to be answered. I would like to thank you for such an informative presentation. I know I certainly learned a lot today, and I do hope that our participants did as well. I did also want to extend another thank you to all webinar participants who joined us today. So for anyone who came in late, I will also mention once more that this session has been recorded, and the link to view the webinar will be emailed to all registered participants. If you do not have the link, or if you experience any problems, do please email us and we'll ensure to give you the link. We would also like to include a link to sign up for our Alberta for KT Platform newsletter, where we share information about upcoming events and activities. On behalf of the Alberta for Knowledge Translation Platform, I'd like to wish everyone a fantastic day and hope you'll join us again next time.